Cerebell focuses on patients with seizures, but specifically, what do y'all actually do and what does your technology do for this patient population?
So often when we think about seizure, we think about epilepsy patients. The seizures are transient. They are benign. Patient can live with seizures for years, and they are visible. Usually you see convulsion. When you move to ICU and acute care patient population, the seizures are complete opposite. They are usually not visible, and patient can be in coma or just confused. And they are not transient. Patient can seize for hours or days, and therefore they are not benign. It can lead to very high mortality and morbidity. It's very similar to stroke. We say time is brain. The early detection of stroke is arguably the biggest driver for best outcome. Exactly same for seizure in ICU patients. So the guideline requires to have EEG, and EEG is the main tool you can diagnose seizure, especially when patients are not convulsing, which is the majority of the patient in the ICU. So in the ideal world, the guideline require you get that diagnosis within an hour. And before Ceribell, not a single hospital on the planet can be compliant with that guideline. The best hospital will take 4 or 5 hours. A very good hospital will sometimes take a day, and small hospitals simply don't have EEG. So you see patient acquire secondary brain injury, which is long-term memory loss, IQ drop, or even die just because their seizure were not detected. And literally you see this, I remember that video. It's an elderly patient. The EEG on the bedside was showing he's in non-convulsive status, which is a very urgent neurological condition, and he's in coma, and probably his daughter was sitting right next to him, not knowing that his dad is going through a neurological urgency because there's no tool to diagnose it. So our system, and the reason is because conventional EEG is very cumbersome to set up. Very few people know how to set it up and takes hours. So our system have a hardware anybody can set up in a few minutes. And then we have a machine learning algorithm that can perform as well as a well-trained neurologist and would tell the bedside physician, who usually do not know how to interpret EEG data, the instant result, is the patient in status or not. So it completely transforms how seizures not only are detected, but also how these patients are managed, because you can see how a patient can respond to the medication and whether or not you need to increase the dose or add the second line medication to the patients.